My name is Jamawid Mazer, and I'm a physician assistant. So my role at Rosalind Franklin is I'm the associate program director for our PA program here, and I also work as a physician assistant for the Rosalind Franklin University health system on the Community Care Connection mobile health unit. So as a physician assistant, we are able to take a history and physical of our patients. We're able to then determine if they need any labs or imaging for their condition. And then we developed a differential diagnosis, hopefully eventually arrive at a diagnosis for that patient. And then we treat our patients. So we provide pharmacological treatment if needed or other modalities of treatment as needed.
I'm Dr. Jeffrey Domashki, and I'm a physical therapist. I teach in the Department of Physical Therapy. Physical therapists evaluate and treat individuals, and then we use a variety of different techniques to help patients out. It may be exercise sorts of activities like strengthening, stretching, aerobic activity, cardiovascular activity. We may use things like manipulation or moving their joints. We may use other sorts of things like physical agents like ultrasound, hot and cold. So physical therapists use a variety of different techniques to really help people get moving. We're movement experts, and we really want to get people back to moving.
Okay, my name is Hope Billick. I am a registered dietitian nutritionist. I am also an assistant professor in the Department of Nutrition in the College of Health Professions, and also an assistant professor in the Department of Medicine in Chicago Medical School. As a registered dietitian, what I am able to do is we look at a person's dietary history, we review medical records, we look at their charts, we look at lab values, and we're able to put together and make suggestions then to the physician on what type of diet the person should be on to help prevent any further seriousness of a chronic disease.
So you might have heard a saying that an ounce of prevention is worth a pound of cure. And I think that's very true. So some of the advice that I have for you is, first of all, if you're smoking, stop. And I know that's easier said than done, but there's resources in the community that can help you do that. If you're drinking excessively alcohol, then you want to reduce the amount of alcohol you drink, or if you don't drink, then don't start. And then thirdly, you want to think about diet and exercise. So just think about making good choices every day of your life in order to look to either prevent diabetes or prevent heart disease, which we're able to do. And if you are diagnosed with heart disease or diabetes, then that will definitely play a big role in your management of these chronic conditions.
What I would do is really talk to them a little bit about the types of physical activity that they should participate in. And the two main types of physical activity would be aerobic or cardiovascular activity, like brisk walking or jogging, and then strengthening activity. Movement is important because physical activity or exercise has so many benefits. There's so many great benefits that we get from moving. It helps make our bones strong, it strengthens our heart, it strengthens our muscles. It also can help us keep our blood glucose or our blood sugar intact. It can keep our BP at normal levels or our blood pressure. It can help with things like cholesterol and help decrease cholesterol. It can also help with triglycerides, or those fatty acids that are in the blood, and it can help decrease those sorts of things. The other thing that exercise or physical activity really does is it really lowers the risk of prediabetes, it lowers the risk of getting type 2 diabetes, it lowers the risk of heart disease, and it also lowers the risk of having a stroke. So the benefits are really, really good. The other thing is it's not just a physical sort of thing where it helps your heart and your body and your lungs and those sorts of things, but it also can help you mentally. It can give you help decrease stress, it can help decrease anxiety, and it can help you feel better overall.
How can you make some simple changes in your life? Go home and measure your cups and your plates and your bowls and switch over to some smaller ones. Help cut down your portion sizes. Use lean cuts of meat. have fish twice a week, increase your vegetable intake, include dark green, dark orange, red vegetables on a weekly basis, whole grains, consume at least 3 servings of whole grains on a daily basis. And then, of course, your dairy product, switch from whole milk, or what some people call vitamin D milk, or 2% to 1% or low-fat milk. Try drinking some water. We do not consume enough water in this country. And lots of times, you think you're hungry, and actually what you are is thirsty. So we want you to choose more unsweetened water instead of soda pop, juices, sports drinks, coffees loaded with teaspoons and teaspoons of sugar. Try some water, and it'll be healthier all the way around.